Hi, my name is Marakita Fuller, and I wanted to talk about the motivational ruler when using motivational interviewing. A motivational ruler is really just a 1 to 10 scale, something similar that you may use if you're a healthcare provider and you ask people to rate their pain on a scale of 1 to 10. This is a way that we can rate someone's ambivalence and help them move forward in resolving their ambivalence and bringing out true change talk, where the client themselves will have to start talking about what it's going to take for them to change. And this is very different from a typical approach where you may say to the client what they should be doing, giving them advice, trying to convince them to change, trying to tell them what will happen if they don't change. Have you ever had a client who continually gave you a bunch of yeah but, yeah but, yeah but, yeah but, the whole time you tried to give suggestions of what they should do? Perhaps someone who's needing to check their blood sugar more often, and you give them suggestions about where they could put their insulin or where they might give themselves a reminder in order to remember about their medicine. And they continue to give you the, yeah, I tried that. Yeah, that didn't work for me. Yeah, that just won't work for us. If you want to stop your client from giving you the yeah buts, motivational interviewing is a great way to be eliciting from your client what is important to them and let them be the one to set their goals. So let's take an example. We'll take me for an example. I'm pretty ambivalent about needing to lose some weight. I would like to lose about 20 pounds in the next, let's say, 3 months. So someone might say to me, well, Marakita, on a scale of 1 to 10, how important is it to you to lose that 20 pounds that you're trying to get off in the next 3 months? And if I think about how important it is to me, it's pretty important. I want to be able to wear all the clothes and outfits that I have, and I don't want to outgrow what I'm wearing. So I would say it's probably, a 5 or a 6. I mean, it's not the most important thing in my life, but it's pretty important. So the counselor could say to me, wow, okay, great, you're a 5 or 6. You're not a 0. Why is it that you're a 5 and not a 0, Marakita? At that point, I'm having to say why it is that I'm a 5. I'm having to voice that out loud as to my priorities and look at my ambivalence. Well, I guess work is more important at this time, and I just haven't been able to really figure out a time to exercise or walk. I just seem to be too busy. I'm really wanting to make it more important in my life, I think, over the next little while. Maybe if I, had somebody to walk with or really made an effort to get up in the morning, it might be more important. And then the counselor can really ask the next question and say something like, well, okay, let me ask you one more question. This is really where the rubber meets the road. On that same scale of 1 to 10, how confident are you that you will be able to lose that 20 pounds over the next 90 days? Now, it's very important that when you voice the question, you make sure that you have a reasonable time frame with the goal. If you simply ask someone how confident are they that they could quit smoking, of course they're going to tell you a 10, because they may say they can quit anytime they feel like it. Now, if you ask them specifically, how confident are you that you can stop smoking, 3 cigarettes a day over the next month, or you can, decrease your smoking to 1 pack a day over the next month? See, that's a whole different question, because that's when you're really putting it to the person of something that they are wanting to set for themselves, and not just some big grandiose concept of quitting smoking altogether sometime down the future. So if you're finding that people are just keep giving you a number 10 when you try the scale, most likely you're not setting up your goal in a way that's specific enough to really allow the person to put a number to it. So when someone asks me about how confident I am, I would say, well, I'm probably only about a 2. It doesn't seem like anything I do doesn't work. I don't feel like I eat that much. I know I don't really exercise, but I'm just really not that big of an eater. I don't feel like I binge eat, and the weight just doesn't ever seem to come off. So probably about a 2. So again, at this point, you want to give the person lots of kudos because it's very difficult for someone to feel comfortable to even give a number. It's a hard thing to voice. So you want to say, wow, okay, well, you're a 2, you're not a -50. And humor always works well when you're talking about a tough situation and really getting someone to be honest with their feelings. Humor can really help kind of lighten the mood. So, Mariquita, what would it take to move you to a 4 or a 5? Again, you don't want to ask the client what it would take to move to a 10 because that's really taking a huge jump. You want to take just a small, doable step. What would it take to move to a 4 or a 5? Well, if I were going to move to a 4 or 5 and be more confident that I could lose the weight, I really need to see that whatever I'm trying to do is working. So if I commit to, walking 3 days a week and drinking more water, I want to see that it's actually making a difference. And if it starts to make a difference, then, my confidence will probably increase. Okay, so what I'm hearing you say, and this is where you can summarize back to them and let them hear for themselves what it is they said. One of the valuable things that we can be as a counselor is to be a reflective mirror, to just hold that mirror up for the client and let them hear their own words back. So what I'm hearing you say is that you feel like you're about a 2 for confidence right now, and that in order to move to a 4 or a 5, you really want to be able to see some change happening in regards to your weight as you impact or start implementing your new behavior change toward walking and drinking water. Is that what I'm hearing you say? Yeah, that's really about it. I think, I can probably commit to start trying to drink, 5 glasses of water a day. I really haven't been drinking water as I should have been. So it sounds like your next step of what you're wanting to do, Mariquita, is to start drinking some more water and starting to walk 3 times a day. When do you think you might start that goal? So that's when you kind of put that time frame with the person to their next step. Well, I'd really like to get going on it. I'd like to be starting by this weekend, starting my water and really get walking maybe by Friday this week and see how it goes. That's really where I'd like to be. So overall, the motivational ruler is extremely effective because it allows the client to be able to start using their own change talk, convincing themselves what they need to do to make their next steps and what goals they would be using to achieve that, rather than coming from you as the counselor or the provider. One of the challenges that people frequently say about using the ruler is that they don't feel comfortable putting it into the conversation. It doesn't feel like regular conversation to them. So what I would encourage you to do as you practice this 1 to 10 scale is find out what kind of transition sentence might work best for you. Some people will say something like, as a nurse or as a healthcare provider, we always use a 1 to 10 scale when it comes to talking about people's pain. Would it be okay, ask permission, if I asked you 2 quick 1 to 10 questions just to see how I might be able to help you? Or you simply may just put it out there and say, would it be okay if I asked you 2 quick questions to kind of see where we're at with things as we've been talking? Or you might say something like, sometimes less of a transition and just getting right to it works better. And just simply go there. You've asked the person about what their goal is. They've said they wanted to stop smoking. And you just simply put it out there. Mr. Smith, on a scale of 1 to 10, where would you put yourself on how, on how you feel about decreasing your cigarettes by 2 a day? How important is that to you to decrease those cigarettes by 2 a day over the next 2 weeks? And you just kind of go right to the question and let them think about it. So we'll continue on with some more pieces of motivational interviewing. Thank you for sharing your time with me today, and I hope that you found this useful to be able to start implementing the use of a motivational ruler with your clients.